If you're over 60, this is something you need to understand. Some routine checkups can do more harm than good after a certain age. Many older adults are trying to do everything right and still getting caught in this. Mr. Harris was 72 when he came in for what he thought would be one of the easiest appointments of the year. No complaints, no pain. He was sleeping well, walking every morning, still driving himself to the grocery store, still fixing things around the house. By his own words, he felt steady. His doctor glanced at his chart and said something very simple. "Let's just run a quick heart test. Nothing serious, just to be safe." It sounded responsible, reassuring even, so Mr. Harris agreed. A few days later, the results came back slightly abnormal, not dangerous, not urgent, just not perfectly normal. And that one word changed everything. Suddenly he was being referred for more tests, then a specialist, then another procedure to take a closer look. Within a few weeks, a man who walked in feeling completely fine was sitting in a cardiology office, being told there might be something wrong with his heart. The stress alone kept him up at night. But here's the part that stayed with me. After everything was done, after the extra testing, the follow-ups, the worry, there was nothing seriously wrong. His heart was functioning exactly the way many healthy 72-year-old hearts do. But by then, the damage wasn't just physical. It was psychological. His confidence had changed. His sense of security in his own body was gone. And I've seen this pattern more times than I can count. Here's what most people over 65 are never clearly told. Not every medical test is helpful just because it exists. In fact, after a certain age, some routine checkups can quietly create problems that were never there to begin with. I want you to hear that again. The test didn't find the problem. The test created the problem. Now, that doesn't mean medicine is broken. It doesn't mean doctors are careless. But it does mean this. What helps you at 45 does not always help you at 65, 70, or beyond. Your body changes. Your tolerance changes. And the way we should approach testing has to change too. The truth is, many older adults are doing exactly what they've been told for decades. Stay on top of your health, get checked regularly, catch things early. And those are good instincts. But what almost nobody explains is when those same habits need to be adjusted. Because after 65, the goal is no longer just to find more things. It's to protect your quality of life, your energy, your independence, your peace of mind. And sometimes that means knowing which tests to pause, question, or even avoid altogether. In this video, I'm going to walk you through 5 specific medical checkups that are still very commonly recommended, but may not be helping you the way you think they are. And more importantly, I'll help you understand why. Because once you see the pattern, everything starts to make a lot more sense. Now, before we go further, I'd like to ask you something simple. How old are you this year? Or if you're watching for a parent or loved one, how old are they? Go ahead and share it in the comments. I read those and it helps me understand who I'm speaking to. Alright, let's take a closer look at the first one, because this is where many people unknowingly take the very first step into that same cycle Mr. Harris went through. Let's start with something that sounds completely harmless on the surface. A routine ECG, also called an EKG. You've probably had one before. Small stickers placed on your chest, a few wires, a quick reading of your heart's electrical activity. It's simple, painless, and takes just a few minutes. And because it's so easy, it's often done just to check, especially after 65. Now, on paper, that sounds like a responsible thing to do. But here's what most people are never told. As we get older, the electrical patterns of the heart naturally change. Not because something is wrong, but because the heart, like the rest of the body, is aging. Think of it like an old but reliable clock. It may not tick with perfect precision anymore, but it still keeps time just fine. What I often see in older patients is this. An ECG shows a small irregularity, maybe a slight rhythm variation, maybe a pattern that looks a little different from the textbook version. And the moment that shows up on the report, everything shifts. You're told, It's probably nothing, but we should take a closer look. And that's where the cycle begins. Because now you're being sent for more testing. Maybe a stress test, maybe a Holter monitor, sometimes even more advanced imaging. All because of a finding that in many cases is completely normal for your age. Clinically, this is something we pay very close attention to, because in people without symptoms, no chest pain, no fainting, no significant shortness of breath, routine ECG screening has a high rate of what we call false positives. In plain terms, that means the test suggests there might be a problem when there really isn't one that needs fixing. And I want you to think about what that does, not just physically, but emotionally. You walk in feeling fine. Now you're being told something might be wrong with your heart. Your mind starts to race. Your confidence drops. Every little sensation in your chest suddenly feels suspicious. That quiet trust you had in your body begins to fade. And this is where it gets important. Because even if every follow-up test comes back normal, that sense of uncertainty can linger. I've had patients tell me, "Doctor, I just don't feel the same since that test." Not because their heart changed, but because the way they see their health changed. Now, to be very clear, ECGs are incredibly valuable when there is a reason to use them. If you're experiencing symptoms like palpitations, dizziness, chest discomfort, or unexplained fatigue that's different, that's when this test can provide real, actionable insight. But without symptoms in a stable, active adult over 65, we have to ask a more thoughtful question. What are we actually looking for? And more importantly, what will we do if we find something? Because if the answer leads to a chain of unnecessary testing or anxiety without benefit, then the test may not be helping you. It may be quietly working against you. So here's a simple way to think about it. Your heart doesn't need to look perfect on paper to be working well in real life. And after 65, chasing perfect numbers or perfect readings can sometimes pull you further away from what actually matters. Feeling well, staying active, and living with confidence in your body. That's the goal. And this is where many people take their first unnecessary step away from it. Now, the next checkup is even more common, and in many cases even more misleading, because it often starts with something as simple as a quick scan of the chest and ends somewhere people never expected. Let me tell you about something I see far more often than I'd like. A routine chest X-ray ordered during a yearly checkup. No cough, no breathing problems, no chest pain. Just, let's take a look and make sure everything is okay. Now again, that sounds reasonable. A quick image of the lungs, the heart, the chest. It feels like you're being thorough, careful. But here's what many older adults are never told. Chest X-rays are not very good screening tools when you don't have symptoms. In fact, in people over 65 who feel fine, they often do something unexpected. They find things that don't actually matter. Let me explain what I mean. As we age, it's completely normal for the lungs and surrounding tissues to show small changes on imaging. Tiny spots, slight shadows, areas that look different from what you'd see in a younger person. Think of it like an old photograph that has a few marks or faded areas. It doesn't mean the picture is damaged, it just means it's been around longer. But when those small changes show up on a report, they rarely get ignored. Instead, you'll often hear something like this. It's probably nothing, but we should take a closer look. And just like that, the next step is a CT scan. Now we're moving from a simple X-ray to a much more detailed image and significantly more radiation. The CT scan may find something even smaller, even less significant. But now that it's been seen, it's harder to dismiss. So the next step might be follow-up scans, or a referral to a specialist, sometimes even a biopsy. And this is where things can quietly spiral, all starting from a test that was never needed in the first place. I've had patients sit across from me completely overwhelmed, saying, "Doctor, I just went in for a routine check and now they're talking about nodules in my lungs." And when we step back and review everything carefully, those nodules turn out to be stable, harmless, something they've likely had for years without any issue. But the stress, the fear, the weeks or months of uncertainty, that becomes very real. And this is where it gets important, because every additional test carries its own risks. Radiation exposure adds up over time. Procedures like biopsies, especially in older adults, can lead to complications like bleeding or infection. And even when everything turns out to be fine, you've gone through a medical experience your body and mind didn't need. Now, to be clear, chest imaging absolutely has its place. If you have a persistent cough, unexplained weight loss, shortness of breath, or a history that raises concern that's different, that's when imaging becomes a powerful and necessary tool. But without symptoms in someone who feels well, routine chest X-rays rarely improve outcomes. They simply open doors that often lead somewhere unnecessary. So I want you to remember this. Not every look inside leads to clarity. Sometimes it leads to confusion. And after 65, protecting your health also means protecting yourself from tests that may create more questions than answers. Now, what we're about to talk about next is even more tempting, because it's often marketed as the ultimate way to catch everything early. And that's exactly why so many people say yes to it without realizing what can come next. Now, this next one is becoming more and more common, especially in private clinics and health packages. Full-body CT scans. You may have seen them advertised as peace of mind screenings, a way to check your entire body in one go and catch anything early. For many people over 65, that sounds incredibly reassuring. One scan, one answer, no guessing. But here's what I want you to understand very clearly. The body is not meant to be searched this way when nothing is wrong. Because when you scan everything, you will almost always find something. Let me explain why that matters. A CT scan is extremely sensitive. It can detect very small changes inside your body, things that would never show up on a regular exam. But sensitivity comes with a trade-off. It doesn't always tell you whether what it finds is dangerous or completely harmless. Think of it like turning on a bright spotlight in a room that's been lived in for decades. You're going to see every mark, every scratch, every imperfection. But not all of those things need to be fixed. In fact, most of them don't. What I often see in older patients is this. A full-body scan picks up a tiny abnormality, maybe a small cyst, a minor enlargement, a spot that looks unclear. And the report comes back with a phrase that sounds innocent but carries weight. Further evaluation recommended. That one line is where everything begins to shift, because now you're not done. Now you're being sent for targeted scans, blood tests, specialist visits. Each step looking deeper into something that in many cases was never going to cause you a problem. And this is what we call the cascade effect. At first it feels like you're being proactive. Then it becomes a series of follow-ups. Then it becomes a cycle that's hard to step out of. I've seen patients who felt completely healthy go through months of testing after a full body scan, only to find out in the end there was nothing that needed treatment. But the emotional toll was real. The waiting, the uncertainty, the constant feeling that something might be wrong. And there's another layer here that often gets overlooked. Radiation. A full-body CT scan exposes your body to a significant amount of radiation in a single session. Now, one scan may not seem like a big deal, but when it leads to repeat scans, follow-ups, additional imaging, that exposure adds up. And over time, that carries its own risk. So you have to ask yourself a very important question. If this scan finds something, what will I actually do about it? Because if the answer leads to more testing, more procedures, more stress without a clear benefit, then the scan may not be protecting your health. It may be complicating it. Now, there are situations where CT imaging is absolutely necessary. If there are symptoms, if there's a clear concern that needs investigation, that's when this technology becomes incredibly valuable. But using it as a blanket screening tool when you feel well, that's where we start to run into problems. Because after 65, the goal is not to search your body for every possible imperfection. It's to focus on what actually impacts how you feel, how you function, and how you live day to day. And this is where many well-meaning decisions quietly go off track. Now, the next checkup is different. It doesn't involve radiation, it doesn't involve imaging, but it can affect something even more personal, the way you see your own mind. And for many older adults, that impact runs deeper than they ever expected. Before we go any further, I want to pause with you for just a moment. If what you're hearing is starting to connect, if you're recognizing some of these patterns in your own experience, or maybe in someone close to you, just let me know you're here. You can simply type the word "clear" in the comments. It may seem like a small thing, but it tells me something important. It tells me this is making sense. Because a lot of what we're talking about today doesn't get explained this way in a typical appointment. And if you're finding value in this, if this is helping you look at your health a little differently, go ahead and tap the like button as well. That helps this message reach other people who might be going through the same confusion, the same questions, the same quiet concerns. And I want you to stay with me here, because what we're about to talk about next is something many older adults don't even realize is happening to them. It's subtle. It often starts with good intentions. But once it begins, it can quietly change the way you see yourself and your future. Let's take a closer look. Now let's talk about something much more personal. Your memory, your thinking, your sense of clarity. This is an area where I see a lot of quiet fear in people over 65, even if they don't say it out loud. Forgetting a name, misplacing keys, walking into a room and pausing for a second, trying to remember why you went there. If that sounds familiar, you are not alone. And here's something very important. I want you to hear. Some degree of memory change is a normal part of aging. It does not automatically mean something is wrong. But what happens more and more often now is this. Someone goes in for a routine visit feeling generally okay, and they're given a cognitive screening test, a short questionnaire, a few memory tasks, maybe recalling words or drawing a clock. Again, it sounds harmless, simple, quick, preventive. But here's where it becomes complicated. These tests are designed to detect changes in thinking, but they are not always good at distinguishing between normal aging and actual disease. So what I often see is this. A person who is functioning well in their daily life, still managing their home, their finances, their routines, takes a test on a day when they're tired, distracted, or a little anxious, and the result comes back slightly below a certain cutoff. Not severe, not definitive, just a bit concerning. And that one phrase can stay with someone, because now the question is in their mind. Is something wrong with me? And once that thought takes hold, it can change how a person sees themselves. They may start second-guessing simple things, hesitating more, withdrawing from activities they used to enjoy, losing confidence, not because their ability changed overnight, but because their perception of their ability did. This is where it gets deeper than just a test result, because the brain is not just a structure. It's your identity, your independence, your sense of control. And when that feels threatened even slightly, it can have a real emotional impact. Now, to be very clear, cognitive screening absolutely has its place. If there are real changes, getting lost in familiar places, repeating questions frequently, struggling with daily tasks, that's when early evaluation is important and helpful. But without clear concerns, routine screening can sometimes do more harm than good. It can label normal aging as something it isn't, and once a label is applied, it's very hard to ignore. I've had patients tell me, "Doctor, I can't stop thinking about that test," even when further evaluation showed everything was within normal range for their age. So here's what I want you to take away from this. Your brain, like the rest of your body, changes with time. That does not mean it's failing. And testing it without a clear reason can sometimes create doubt where there was none before. Instead of focusing only on scores, Pay attention to your real life. Are you managing your day, staying engaged, having conversations, making decisions? That matters far more than a number on a short test. After 65, protecting your health isn't just about what we find. It's also about protecting your confidence, your sense of self, and your peace of mind. And this next checkup we're about to talk about, it's one almost everyone is doing regularly, often without ever questioning it. But it may be shaping your health decisions more than you realize. Now let's talk about the one I see more than almost anything else: frequent routine blood testing panels. For many people over 65, this has become almost automatic. Every few months, sometimes every visit, a full panel of labs: cholesterol, blood sugar, thyroid, liver, kidney, vitamins. It feels responsible. It feels like you're staying on top of things. But here's the part that often gets overlooked. The more often you test, the more likely you are to find something slightly off. Not dangerous, not urgent, just outside the normal range. And that's where the problem begins. Because those normal ranges are not always designed specifically for older adults. They're broad averages, often based on younger populations. So what is perfectly acceptable for your age may still show up as mildly abnormal on paper. And once a number is flagged even slightly, it becomes very hard to ignore. I've seen this happen countless times. A patient feels fine, no symptoms, living their daily life without limitation. But their lab report shows one or two values just outside the range. Now suddenly the conversation changes. We should monitor this. Let's repeat the test. Maybe we should start a medication just to be safe. And before long, that person is taking something they never needed. Not because they felt unwell, but because a number suggested something might be wrong. This is where I want you to picture something. Imagine your body like a control panel with dozens of dials. Each blood test is checking one of those dials. Now imagine adjusting every single dial just because it's not perfectly centered, even when the machine is running smoothly. Over time, you're not improving the system, you're interfering with it. And this is exactly what can happen with overly frequent testing. We stop treating the person, and we start treating the numbers. Now, to be clear, blood tests are incredibly valuable when used with purpose. If you have symptoms, if there's a condition being monitored, if there's a clear clinical reason, that's when testing guides smart decisions. But when it becomes routine without a specific question, it can lead to something we call over-medicalization, where normal variation is mistaken for disease, and small, harmless fluctuations turn into long-term treatments. I've had patients come to me taking multiple medications, all started because of minor lab changes that over time never actually caused them any problems. But the medications did. Side effects, fatigue, dizziness, interactions, and the original issue. It often wasn't an issue at all. So here's the question I want you to start asking. Why are we doing this test, and what will we do with the result? Because if the answer leads to more testing, more medication, or more worry, without a clear benefit to how you feel or function, then it's worth reconsidering. After 65, your health is not defined by perfect numbers on a page. It's defined by how you move, how you think, how you live. And chasing perfection in lab values can sometimes pull you away from that. Now, when you step back and look at all 5 of these checkups together, a very clear pattern begins to emerge. And understanding that pattern may be one of the most important things you can do for your health moving forward. Before you go, I want to ask you something very simple but very important. Have you ever had a test that led somewhere you didn't expect? Maybe it started as something routine, something you agreed to without thinking twice. And then suddenly it turned into more appointments, more questions, more uncertainty. If that's happened to you, I'd really like you to share it in the comments. Not just for me, but for others who are watching right now. Because sometimes hearing someone else's experience is what helps another person pause, ask a better question, and make a more informed decision. And if this conversation helped you see your health a little more clearly, even in a small way, go ahead and tap the like button. That simple action helps this message reach other people over 60 who may be going through the same confusion, the same quiet concerns, and who deserve to hear this explained in a way that actually makes sense. And if you haven't already, consider subscribing. This channel is here for one reason: to give you clear, honest, experience-based guidance so you can take care of your health with confidence, not fear. Because you've earned that. You've lived long enough to know your body matters, and you deserve information that respects that and supports you in the years ahead. Take care of yourself, and I'll see you in the next video.